Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in beautiful Phoenix, Arizona, where today it is 107 degrees. It's dry. Today I'm at the Phoenician Resort, which is one of the multiple five-star resorts here in the Phoenix metropolitan area. Absolutely gorgeous. You have this hustling, hubbub metropolitan area, and then this little oasis here at the Phoenician. It's over 200 acres. It has 9 pools, one of which is behind me. It has a championship golf course, 11 tennis courts, a beautiful well-being spa, which is actually in front of me here. And it sits up against Camelback Mountain, which is in the background here, which is visible from all over the valley, and it's shaped like a camel. You have sort of a smaller end, which is the hump, and then the camel front. So the topic for today is 5 things you should look for in a chiropractor. In this day and age, the 21st century, it is not enough for a chiropractor to simply be in the business of performing spinal manipulations. Now, spinal manipulations have been shown to work for multiple problems, such as acute low back pain, or neck pain of acute or even chronic severity. But in this day and age, there are so many other treatments that can help a patient non-operatively for back pain, neck pain, what have you. It's not enough to just go get a manipulation and then go about your day, because the best outcomes are not from one type of treatment, they're from multiple. So what I compiled is a list of 5 things you should look for in a chiropractor when trying to pick one to treat you. One of them is the ability for the chiropractor to be trained in both active and passive spinal manipulations. Well, what does that mean? Okay, most people are able to tolerate an active spinal manipulation, such as one of ours at Preferred Pain Center utilizes the diversified technique. We have another chiropractor who utilizes a different type of technique. So there are multiple different types of active manipulations, and you should have a chiropractor who's able to do the active type. The other one is passive manipulations. There might be times where patients can't tolerate an active manipulation. One being pregnancy. Pregnant patients shouldn't have an active spinal manipulation. So there's a technique called the activator technique. It utilizes an instrument that can do a spinal manipulation. That can be very effective for patients who are pregnant. Another patient might be fibromyalgia. They might not tolerate being touched with an active manipulation. So that's the first thing, one who has active and passive. Another one is the chiropractor should be trained in spinal decompression techniques. The table that we have at Preferred Pain Center is the Kennedy Decompression table. Our chiropractor is especially trained and certified in that technique of the table. So he can cater the treatment to the patient specifically to help with either their neck pain, their back pain, arm pain, leg pain, for their specific diagnosis so they get the best outcome. The chiropractor should have special training in that. The other one is the chiropractor should have some training in massage, acupuncture, or both. That can be very effective, and you should ask whether or not your chiropractor is trained in such techniques. The other one is manipulation under anesthesia. Manipulation under anesthesia is a technique that has become more common over the last 10 years. It's very good for diagnoses like frozen shoulder or pelvic issues, other tightness in joints such as the neck, even the low back. But what you want is to know whether or not A, that treatment is for you, and B, be under the treatment of somebody who can actually do it. It's a multi-day treatment, non-operative. It does involve sedation, but it can be extremely effective for some of these issues. Another one that you want is a chiropractor who's trained in physical rehabilitation. Physical rehabilitation is basically the same types of things as physical therapy, but it's the term for what chiropractors are trained. It's the same exercises, lumbar stretching and strengthening, core strengthening and stability. These are the types of things that can help dramatically along with the other things that I'm mentioning. To round out the 5, a chiropractor should be associated with a pain center. They don't have to be in a pain center, but they need to be associated with one. Why? Because it helps round out the treatment and it is better for a patient. So at Preferred Pain Center, we do multidiscipline types of treatment, which includes chiropractic, rehab, acupuncture, along with having MDs and DOs who can either prescribe pain medication or do interventional treatments like facet injections or radiofrequency ablation. You need to have these treatment options available so that it can be what's best for you. Patients come in with unique circumstances. They're not all the same, so they shouldn't be treated all the same. They should be treated with a catered, tailored program that is best suited to the condition that's being brought in. So there you have it, the 5 things you should look for in a chiropractor today in this modern era. We have all of these options at Preferred Pain Center. Check us out on the internet at www.preferredpaincenter.com. You can also give us a call at 602-507-6550. We will get you in within 24 hours. I'm Dr. David Green, Preferred Pain Center CEO. Your pain stops here.